Hi, and welcome to RXTV. Today we're going to be talking about metabolic syndrome. What is metabolic syndrome? Why is it important to you? And what are the complications of it? And how do you even get diagnosed with it? And then, most importantly, how do you prevent it or avoid it or, in most cases, reverse it? So that's what we're going to be talking about today on my channel RXTV. I'm Jennifer, I'm a pharmacist, and here we talk about your health from A to Z, anything from prescription medications to OTC medications, diet and fitness and disease state management. If you like to stay informed about these topics, please put a like and subscribe to my channel. And then as soon as I get them out, I hope you see them and I hope that helps you stay healthy. But back to the topic today, which is metabolic syndrome. Most people don't even know that they have metabolic syndrome. They usually go to the doctor after they start having some sort of symptoms that are related to high blood pressure, like headaches or dizziness or something like that, or extreme fatigue. And then that's when they find out that they also have this condition called metabolic syndrome. And 23% of adults actually have this and they don't even know it. This is very similar to having pre-diabetes and not know it, or having diabetes itself and not even know it, until it gets bad enough for you to have some symptoms that require you to go to the doctor. Most people don't even know that this is happening because some of this comes on over time, over gradually, from several different reasons, mostly poor nutrition and lack of exercise. But when they do finally have it, then it's time to start looking into how you treat it. Now, how is it diagnosed? Well, first we turn to the board and we look at it has to actually be a number of conditions together. And one of those conditions that we'll start talking about first is high blood pressure. High blood pressure, as you know, can cause dizziness and headaches, and it can also cause fatigue. And then another condition would be high blood sugar, which could cause hyperglycemia. There's a lot of symptoms that come with having diabetes. People can have want to be very thirsty, urinate a lot. They just feel very run down. One minute they're up and feeling okay, and then when their sugar drops, they feel very dizzy. So then the next thing we want to talk about is excess belly fat. Now, if you have a lot of fat around your belly area, that's considered harmful fat because it's visceral fat, and that kind of fat actually stores a lot of toxins. And when those toxins seep into and around your organs and also through your cardiovascular system, it can cause a lot of complications. So, what you really want to do is, even right now, if you know that you have that apple shaped body or that pear shaped body where you know you're carrying a lot of excess weight, you still want to be able to go ahead and start working on your fitness and start working on your nutrition, not just for the aesthetics of it, but because it can eventually lead to high blood pressure and high blood sugar, even though it hasn't presented yet. Okay. And then also, if you do go to the doctor, then you could also find out that you have high triglycerides and low HDL. HDL is the high density lipoproteins, which is actually a good portion, the good cholesterol in your cholesterol panel. And actually, the healthier you eat, the more that goes up. And then the triglycerides being high, any one of any three of these conditions together, so three or more, would label you or diagnose you would be diagnosed with having metabolic syndrome. Now, once you get that diagnosis, what does that mean? Well, it's not very good, because then you're going to run into a lot of complications, physically. And I've just written over here on this side of the board some of the complications that happen. And this is not even a complete list, but the list that I have here are some of the leading causes of death that are out there. The first one is atherosclerosis, and that's a hardening of your vessels. Okay, so blood can't pump in and out. There's also, well, it can, but really hard to do. And then there's also diabetes, which you may already be familiar with. Where you could be either insulin resistant or you have just high blood sugar during the day, and that can wreak havoc on your body, as you well may know. And then sometimes that is also asymptomatic and you don't know that it's happening. until you start getting tested. And then there's also kidney disease, and that also follows generally along with high blood pressure and diabetes. And then there's also stroke. You can actually have a stroke when you're diagnosed with metabolic syndrome, because there's just a lot of clogging in your arteries. And once the blood can't get through, that's going to cause a stroke. And those are very dangerous. And then you could also have non-alcoholic fatty liver disease. And in that situation, if that goes unchecked, you can actually lose your liver. Then there's also peripheral artery disease and then cardiovascular disease. So this is a whole host of problems that can happen when you have metabolic syndrome. So then what do you want? What do we do about it? Can you prevent it? How can you reverse it if this is what's happening? Well, the first thing you want to do is have an exercise plan and also have an eating plan that's sustainable for you, and attainable. Because if you actually lose about 7 to 10% of your body fat, you can actually reduce some of these markers for these diseases. You can lower your blood pressure, you can lower your blood sugar just from losing that little bit. So, a lot of people think, oh no, I can't lose weight. I have to do this very stringent thing. I have to suffer. I have to starve myself. I have to work out like a mad person. And then it's just so hard to keep up with. And as soon as I'm, tired from work, or as soon as I'm stressed out, I'm just going to overeat, and it's going to go back to the way that it was. Or if I lose all this weight, my body is my set weight is just going to, make me want to bring it all back up. Well, I mean, a lot of that it's the struggle that everyone goes through when they're trying to lose weight. I mean, even if you're a small person, you still have a set weight, and it's very difficult. That the best way to handle that, though, is to find a eating routine, or a diet plan that's maintainable, that's something that you can do every day, that you're satisfied with, but replaces all of the foods that stress when you stress eat, or replaces all the carbs, and replaces all the sugar. Because when I start talking about sugar, we're also talking about one of the main problems with metabolic syndrome is an increase in insulin, because insulin can do a lot to your body to cause metabolic syndrome. It can increase your blood pressure. It can increase your uric acid, which inhibits your nitric oxide levels, which when you talk about nitric oxide, you're talking about like your capacity to do work within your muscles, within your lungs, your body, your endurance, your stamina. There's a lot that goes into that. So we don't want nitric acid, not nitric oxide depleted. Also, there's salt retention that can happen, and salt retention can lead to, again, to high blood pressure. And also, if you have diabetes, you don't want to have your salt too high. A lot of people go on to the DASH diet when they have this combination of high blood pressure and high blood sugar. Then there's also that insulin can decrease your HDL. So there's a lot of different reasons why this can can happen. And you just want to make sure that you get your insulin under control. And how you do that is by getting your sugar under control. You really don't want to have more than 25 grams of sugar a day, and that's pretty much on the high end of sugar. There's plenty of things that you can do to replace sugar. You can have cinnamon, you can have honey, within reason. And then also there's sativa. You could try some of that, but you definitely want to stay away from the beverages that contain a lot of sugar. Even orange juice can have a lot of sugar in it, or does have a lot of sugar in it. Another thing is you want to stay away from, if you go to a party, you want to cut down on snacking on the cakes and the pies and the cookies and all that, especially even around the holidays. You just have to really kind of keep that stuff in check, but you also want to eat good foods that are going to keep you full, so you don't want to keep snacking. Another thing is carbs. If you eat a lot of carbs, you're going to also turn that right into sugar, and it's going to help, increase that belly fat. So you need to start eating more foods such as green leafy vegetables, or cruciferous vegetables, good plant proteins, or just stuff that's going to fill you up, so that you don't snack so much on anything that's sugary and anything that's too high in carbs. Okay, there are some good carbs out there, so don't feel like you can't have any at all, but it's all, within moderation and within reason. And mostly, people just really need to fill up on the good foods first. And then after you got your diet into a state where it's maintainable, then you want to get some exercise in. And the best exercise plans are a combination of things like having a an hour or so of cardio, or if you can do that much, or you could start with 30 minutes of cardio and then having some strength training and some high intensity interval training. Now, with metabolic syndrome, you always have to ask your doctor first, what can I do? What is the level of activity that I can actually start with without having an episode, without, you could get a stress test or something like that. But if it's just a simple, 20-minute walk, if that's what you can start out with, or if it's a 30-minute walk and then you build up to an hour walk and then you build up to a jog, like these are the ways that you can go ahead and start getting your body into shape. And then you could, after the doctor okays, you could start with some other things. You could start with, some strength training, some little barbells or whatever. Okay, I actually have exercise program that I wrote. It's called Metabolism Overdrive. A friend of mine is running that program. So if you ever want to ask, see that, you can just message me at the bottom and I'll show you how to get to that. But also, one of my favorite diet plans is actually the Egyptian Smoothie Detox Slim Down. That's a plan that I wrote. It took me a couple of years to get it all together. It is a smoothie program, but all the smoothies have in it healthy fat, healthy proteins, and vegetables and fruits. So it's not something that diabetics would have to steer clear of, because it's not all, just fruits and everything in there. They taste wonderful because I've, found a lot of plant proteins that actually have good fats in them, some avocados, like everything that you need to have a perfect ratio of a replacement meal. And when you start having these kind of smoothies, what happens is you will see that your skin starts glowing, you have more stamina, you have more energy. A lot of these conditions start to become under control. You start to lose weight, all the excess fat, and you start to just generally feel better because they're so packed with vitamins. And I love to use herbs and spices in there, because those are, just powdered forms of just power packed with vitamins and antioxidants, and they just get rid of those toxins that are in that visceral fat. So if you want to check that out, it's egyptiansmoothie.com. Again, you could just lose 7 to 10% of that body fat starting off. It's super attainable, because if you do lose 7 to 10% first, then you can always go back and try and lose more to get back down to your ideal body weight. But it's a good starting point. It actually helps lower your blood sugar, lower your A1C, all these good things. So go, if you want to check out the way I do it, then definitely go, like I said, to egyptiansmoothie.com. I know I said that a few times, which I don't normally do, but go check that out, because it will get you started on reversing or preventing or avoiding this condition altogether. So thank you so much for joining me today, and I will be putting out more videos, so I hope to see you there. Okay, thank you.